All righty. Let's look at the different programs available that can assist with certain things, what election period to use when, and things of that nature. All right. Be patient with me here, guys, and we're going to get through this. Okay. So we'll look at those couple of options here today. And if you have any questions, as always, reach out and I'll be happy to answer, clarify, and all that good stuff. All right. What we'll cover, why Part D and LIS and extra help matters, benefits of the program. Okay. Now, the overview of the LIS and extra help program and like eligibility rules, how to apply online versus on paper, how you can help your clients actually successfully do it online, for example, and what it does for them, and then any other resources. Okay. Now, the benefit of extra help, it's not just one, it actually has various benefits. It does provide access to lower prescription drug costs, as I mentioned before, in like a couple of other videos when we were troubleshooting Sunfire. It does waive the late enrollment penalty for Part D. So if anybody failed to enroll into a prescription drug plan, that actually extra help program can waive that Part D late enrollment penalty. It allows for several special election periods, which are also called SEPs, right? What that means is basically that you can change plans once during each quarter, for instance. So right now we're in the second quarter of this year. So between April and June, you are able to make a one-time change if you have extra help. Okay, so that would be the SEP that you use. The only time that you can't use it is during the annual enrollment period, October 15th till December 7th. And then also the application can trigger application for a Medicare savings program. And that would be QMB, well, there's FBDE, QMB, SLMB, and QI. And if you're working directly with a client, you may still want to complete a separate application for the Medicare Savings Program to expedite the process. Okay. So long story short here means if you do have the ability to assist seniors or Medicare eligible members online with this. And if you go on the Extra Help website where you fill out the application, all the way in the bottom left corner, it does state and have a checkbox that asks, do you want this to send do you want the application to also be sent to the state of the individual that the individual resides in? If you leave that checkbox unchecked, so you really just check it if you do not want that to happen. And if so, therefore it goes to the state. And if you want to expedite that process, you could basically go simply Google applying Medicaid and then the state that you're applying in, and then assist the individual applying that way. Okay. And then as you guys can see down here, extra help is an estimated to be worth at about $5,000 a year, depending on what the individual has going on. Okay. Now, who are the key federal players? It is Social Security Administration, also called SSA, and the Centers for Medicare and Medicaid Services, which you will hear me talk about CMS. They work together to administer the plans and actually educate the public about LIS and extra help. Okay. SSA, Social Security, they do handle the applications and eligibility to determine if you qualify for it. And then CMS more so administers the program, also handles like Part D plan assignment for those who are eligible. And they do also coordinate subsidies to Part D plans for eligible enrollees. Okay, so LIS is not Medicaid, guys, and I want to be very clear here. LIS does two things for you. It helps you with the monthly premium payment. If the plan does cost something, it helps you with that. And then the second thing, it does lower medication cost. Okay. Now, who qualifies? That's a really good question, right? And that's why we have even income-specific brackets. They just came out with a new one. So the numbers went up just a little bit, but in general, it's very similar here. So basically, you have to have Medicare Part A and Part B in order for you to qualify and live within one of the 50 states or the District of Columbia. And then last but not least, since it is an income and asset-based program, your combined savings, investment, and real estate cannot be more than $29,160 a year if you are married. Now, if and you're living with your spouse. Now, if you're by yourself, you can roughly make $14,610. And so just to kind of clarify here, if you have real estate, meaning your own property that you reside on, that's totally fine. Same with a vehicle. But if you draw any income, meaning you have a rental property, then that would count against you because you're drawing income from something else. Okay. And same thing with investments and things of that nature. If you have investments that you could draw money off, then that would count as a source of income. And they are able to check those things. Okay. All right. And then if you have like life insurance, burial plots, irrevocable burial plots, things of that nature, those are not countable. Okay. All right. Now, the two levels of extra help that there is the full help, which is considered the full subsidy for those with lower incomes and few resources. And then there's the partial help, which is a partial subsidy for those that are slightly above those with the lower income, but still need assistance on that end. Okay. All righty. I'm just going to pause here real quick. Give me a second. All right, guys. And so you might wonder what are the benefits of actually having the extra help program, right? Or LIS, which is called low income subsidy. It is the same. Extra help and low income subsidy is the same. Okay. And I'll go a little bit further into detail in just a second. But basically, both full and partial subsidies, actually, as I mentioned, they do eliminate the Part D coverage gap. Okay. And we'll go into what the coverage gap is. There's 4 different stages of medication cycles where basically throughout the year there could be a cost for the individual depending on what medications they do take. And then also there is no late enrollment penalty for the premium with anyone that does have that LIS or extra help. Okay. All right. And again, if you have any questions here, just let me know. Now, to kind of take a look at what the people that do have full extra help in 2022, they don't pay the Part B premium. I'm sorry, Part D as in dog, which is really the D as in drug. As long as they enrolled in a benchmark plan, which would be basically a plan that is below the LIS premium amount. Okay. If you have $100 a month Medicare Advantage plan, then that might very likely not be covered. But what I've seen mainly happen, guys, is if your plan is in around the $30 monthly premium payment or below, then those plans with full subsidy actually or with full extra help, they go to $0. And I'll show you how you can look up how much the cost would be in Sunfire. Okay. Now, they would not have the Part D deductible. And then also their co-payments for their medications, like generic medications, are usually up to $3.95. And then for brand specific medications, it's usually around like $9 and some cents. Okay. Now, certain people with incomes below the 100% FPL, they do pay about $1.35 for generic and up to about $3.80 for brand specific medications. But again, I'll show you how you can look that up. And then after they reach a certain limit, like the $5,100, they wouldn't have any copays, so they would not be responsible for anything because they live on a tight budget. Okay, I'm talking about $800 a month and less. Okay. Now, what counts as income? So we have things such as your Social Security check or any form of your retirement, so SSI, railroad retirement benefits. If you get a pension and have an annuity or any veterans pensions, if you still work, some of my seniors, they do still work, right, at Walmart or so. So those are concerned. Those are concerned income, as well as if you are self-employed, they would look at your net income, any form of alimony, rental income. Again, this would be the net as well. Now, what's not included is, for instance, if you get food stamp, right, or LIHEAP, if you get the full assistance benefit, and then $20 of monthly unearned income, such as like Social Security, etc. And then another thing is like work-related expenses for people that get Social Security benefits with like a certain disability or blindness. Okay, so those are excluded. Now, what does count as an asset? Because it is an income and asset-based program, right? So countable resources, they do include financial institution accounts, such as like checking, savings, a CD at the bank. And basically here, you cannot have more than $24,999 in your bank account. So if you have $25,000, you don't qualify for the program, okay? Ms. Jones, do you have any cash stacked under the mattress, right? So no cash at home. You can't have any stocks, bonds, savings, mutual funds, individual retirement accounts like IRAs or 401ks or anything of that nature. Nor can you have any sort of real estate that actually do hold equity, right? Or any other property that is other than your primary residence. Okay. And then certain trusts that allow a person to revoke or have direct use of funds. Okay. Now there is a few that are not included. As I mentioned, we have here, like for instance, the home that you reside in, the vehicle that you own and that you actually actively use. You're not renting it out and making money of it. Any sort of household goods, furniture, personal effects like jewelry, etc. And then also if you have some sort of life insurance, like a whole life insurance policy that has a cash surrender value, they are not included, okay? And then in-kind support, like non-cash that helps as shelter or revocable burial trust, burial contracts, plots, etc. All right. Now, what are some automatic qualifications here? So even if you meet these conditions and you do not complete an application, if you have Medicare and a Medicare supplemental Social Security income, or if you have Medicare and Medicaid, because you automatically have access to extra help, okay? Anytime you have Medicaid, you automatically have extra help. The extra help income is a little bit higher, so you're able to, people that don't qualify for Medicaid, they might qualify for extra help. But anytime you do get extra help, anytime you do get Medicaid, Medicaid includes extra help. Okay. What that means is that let's say you can make up to $15,000 a year as an individual, and Medicaid you can make up to 14,000. Well, if you qualified for the lower one, then you're definitely going to qualify for LIS, and that's why you automatically get it. I hope that makes sense. It was super confusing to me in the beginning. And again, if this is confusing, I'll be happy to specify it at a later time a little bit more. Now, there's a couple ways to sign up for it, right? You can call Social Security, have a stiff drink ready because that can take some time. You can apply in person at your local office. Since the virus, they kind of been doing things by appointment a lot, and there's long wait times as well, even with appointments. Or the easiest way, in my opinion, you just go online and start the application, okay? And that's where we jump in and help our beneficiaries because some of them don't have a computer or not as tech savvy, etc. Okay. Now, this is what the application kind of looks like. And we have the link, as I mentioned, that was on the previous slide. So the extra help with Medicare prescription drug plan costs. So if you just read through this information here, long story short, at the bottom where you see apply now, this is where you would get started. Okay. Now you should have completed this application for extra help only in the on the internet if, and then it basically tells you those income and asset limits. And if you do, you hit that button, which is right here. What do you want to do? Apply or return. Okay. So we have a formulary, or we have a document within the script that actually shares with you how much it is. To make it a little bit easier, I also created like a little table so that you don't have to have a 3-page document and it's just embedded into the script. So that way, you know, Ms. Jones, how much do you draw a month? If she tells you I'll draw 1460, you always have to add the $170.10 for the Part B premium to it, unless they're already on Medicaid, then they're not paying it. But otherwise, you always have to add that because Social Security does take out the $170, which is the Part B premium for 2022. It does increase usually on an annual basis. So don't be surprised if it's more next year or in the years to come. But they basically take out their portion before they send the member their social security check. Okay, so just because Ms. Jones says she draws 1460, you do want to verify with her. Now, Ms. Jones, is that what comes into the bank account every month, or is that actually plus the $170, right? Is that net or is that before? Okay. Now, there's just some basic, or it starts off with actually some basic information. If they have a spouse, you have to be really careful because, again, they have to meet that income target together. If they're above it, they won't get approved. But then also you will need the spouse's information, even his social, etc., in order for you to complete the application. Okay. So you have their name, their social, their date of birth. Okay. And then also if they worked within the last couple of years, usually that's kind of the question. And then the next question, and I have those questions actually on the script. So don't be surprised when we're asking like weird questions. How much do you draw every month? There's a reason why we ask them, because once we then fill out the application, we need that information in the system. Okay. Not to mention, we need to know, do they qualify, or are we wasting our time suggesting this here? Okay. Now, the first question is basically about their living situation. If there's anyone else, dependents do raise the income limits dramatically. So you have to be careful if they don't live by themselves. Okay. And then you see some additional things such as, do you receive Social Security benefits? If they do, oftentimes they ask, well, how much do they receive? Do they receive railroad retirement benefits? How much? Do you receive veterans benefits? Do you receive income other than a pension or annuity? Do you receive any other income listed above? Blah, 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 right? So you would answer those questions based on it. Most of the times, those are all no answers besides the Social Security income, okay? And then you are able to submit the application. And let's take a look here. Next, what will happen, it does take about 2 weeks for the LIS extra help to get approved, or the decision to be made, not get approved, a decision to be made, right? The beneficiary's information will automatically be sent to the state, as I mentioned, unless you check that box, to see if they also qualify for the Medicaid savings program. Okay, they will get a letter in the mail if they got approved for Medicaid or not. I'm sorry, for LIS as well as Medicaid. However, you do have the opportunity by using their information to look also on Jarvis or a couple of other sites to see if they have gotten approved for LIS. Okay. All right. And then the second part is basically Medicaid. Now, really important, Medicaid is state funded, right? So it's a state funded program. Okay. And then it is an income and asset-based program. As you could hear the kind of questions that they're looking at income and asset. So if somebody ever asks you, now, why you're asking me that, you can simply say, well, Ms. Jones, I'm not nosy solely because it is an income and asset-based program. And they have similar prerequisites such as like LIS and extra help, okay? Now, Medicaid approval, that process usually takes about 4 to 6 weeks to get the approval or denial answer. Again, they also will get a letter in the mail from their local DFACS office. We can check that again if they got approved. If there is now an existing Medicaid ID number, we would be able to use our tools that we have to look that up, like Humana, Jarvis, you can the chat, the call number, and things of that nature. Okay. Now, I want you to pay close attention to the levels, okay? There's different levels to Medicaid. And so we did take a look, because each plan, like especially dual special needs plans, those are dependent, your eligibility is dependent on your level of Medicaid, okay? So anytime you do speak to a member that is dual eligible, you have to make sure that they're all aware of what level they have. And you always want to double check, it's my recommendation that you do on the carrier's websites to see, run their eligibility verification quickly and see what they really have. Reason for that being is if you don't do it, they tell you to have QMB and they come back with SLMB and you put them on a plan that's only eligible for people with SLMB plus or higher, that application is not going to go in effect. Okay, so you missed a month off that you could have been compensated, and more importantly, get the client covered accordingly. Okay, so the highest level of Medicaid is FBDE, full benefit dual eligible. Now, what that does, guys, it pays Medicare Part A and Part B premiums. Okay, so the $170.10 is covered. And for instance, I have a client right now, she's been fully disabled. So she just got Part B, but she does not have Part A, meaning she didn't work her 10 years. Okay, you have to work 10 years or 40 quarters, which equals 10 years, pay into the tax system. Really, that's what it is. And that's how you are eligible for it. There's a few other ways. And so what we're doing right now with her, because very often if you have a FBDE, the Part A, which usually costs about $455 as of the moment, that Part A actually is covered and paid by Medicaid. Okay. It also pays any sorts of deductibles and co-payments. So if you look on a breakdown for dental or doctors or anything, outpatient surgery, etc., or even the hospital patient stay, those are all covered. So if somebody has a Medicare Advantage plan and they have full Medicaid, they're not supposed to pay anything. Okay, there is some exemption if you're on an HMO and you go out on network, there might be some sort of a fee, but in general, the rule of thumb is if you have full Medicaid, you do not pay anything. Okay, as long as you're in the correct plan and you're following the guidelines. Now, the next level is QMB, which a lot of people have QMB, not so many have FBDE. So you'll run into a lot of QMBs, SLMBs, and then QIs. Okay. The QMB stands for Qualified Medicare Beneficiary Program, which is full Medicaid. Okay. And then it pays the Medicare Part A and B premiums, the deductibles, and co-payments. So it's really the same as those are the same, and then those are pretty much the same. The only thing I was going to add here is the only difference is the income limit. Okay, so this is the lowest income limit. It goes a little bit higher, and then you go right around here. And I'll show you in the next couple of slides how much you can make roughly. Now, the next one is the SLMB. And as you can see, there is a difference. It's called Specified Low Income Medicare Beneficiary Plan, which is also considered, we call it, do they have full or partial? That would be partial Medicaid. Okay. Now, the benefit of that is if somebody has SLMB, they do still get the $170.10 a month paid for by Medicaid. Okay. And if you think about it, somebody that makes $1,200 a month, $170, I mean, for me nowadays, every dollar counts, right? That you're making a big difference and a huge impact on the family that or on an individual that you're able to save $170 a month. Not to mention, if they now have Medicaid, partial Medicaid, they're eligible for food card benefits and lower co-pays and things of that nature, okay? And remember, they also automatically get LIS, so their medication cost is lower. And if the plan premium does have a monthly premium, very likely, depending on the level of LIS that they get, they would also be able to save on a monthly premium payment if they were on a plan that has one. And then last but not least, we have QI. I've seen QI1 lately. Basically, it's qualifying individual program. Now, the difference here is you do have to apply every year and it works on the first come, first serve basis, whereas the other ones, you don't, there is no first come, first serve. And unless something changes drastically in your income limit, usually you're good to go within those, okay? But the positive thing here again is also it pays the Medicare Part B premium. And that's the only thing that it does. Besides, again, any level of Medicaid does have LIS included. So they also have the benefits that I was just mentioning. All right. Cool beans. Now, if you wonder how much can somebody make and based on the level, this is kind of where I've broken down how much they can make. You do see that I didn't put the FBD on here simply because it is if you are below what you see on QMB, that means you're going to be FBDE, right? And again, I will update these numbers soon because we just got the new plan out. So for 2022 going into 2023. So just be patient with me here, okay? Now, if you are an individual, and the income limits are per state, but they're almost the same. Like they're very, very similar, I would say. So in Georgia, for example, to qualify for full Medicaid QMB, you can make as an individual $1,083 in income, right? That's including the 170. So if your check is like $850 plus the 170, you should not be over this. Then you would qualify for it as long as you don't have any assets, etc. And then the assets, you can have assets that are worth no more than $7,860. Okay. Now, if you and your spouse, you can make together $1,457, and you cannot have more than $11,800 in assets. To qualify for SLMB, you can draw about $1,296 or have that in income, $7,860 in assets, $1,744, and then $11,800 in assets. Okay. And then for the last but not least, the partial QI Medicaid, you can draw about $1,456. So in my head, I was thinking close to $1,500, but you have to be below it to qualify for it. And then it's $7,806 in assets. If it's a spouse or a couple, you can draw together $1,960 and have $11,800 in assets. And then last but not least, for the extra help program, Part D, which is also considered LIS, low income subsidy, you can draw about $100 more. You can draw about $1,595. You can have up to $14,610 in assets, as well as if you have a couple, they can draw about $2,155 and have $29,160 in assets. And I have this chart here in our presentation where in our script, basically, so that you have a quick reference point when you go over it to see, do I want to continue on this route or do I want to actually take over somewhere else? Okay. You will have some questions about this, guys. Please, please, please. It's going to take you some time to let it simmer in and all that. It's important that you have this information. You can rewatch this video at any given time. That's why we're recording it for you. And I'll be happy to answer any questions here. Okay. So I just want to differentiate again the two. We have Medicaid. If you have any sort level of Medicaid, you automatically get LIS. And then if you apply for LIS because you draw over $1,500 a month, you can potentially only qualify for LIS, okay? That does not give you access to Medicaid. LIS does not pay the $170. You have to have one of the stages of Medicaid that will pay the $170 and some, okay? Now, the benefit of having also an LIS plan, we already talked about it. For one is that it pays your, it lowers your prescription drug cost, and it can lower the monthly premium plan. There was one other thing that I was going to tell you. There's a couple of plans that are more beneficial with lower copays. I call them the LIS plans, basically for people that have LIS but don't qualify for Medicaid. Make sure you check with me what those plans are, right? Because a lot of individuals don't know that there's plans available that would go to $0 and they have lower copays than regular Medicare Advantage plans with a $0 premium plan, okay? All right, guys, and then just to take a quick look here at the special election periods. So anytime a beneficiary qualifies for Medicaid and or LIS extra help, he or she will be eligible for an SEP. Okay. Now, while completing each application, you are required to select an election period. And so if outside of an annual election period, obtain the reason for eligibility into an MA or MAPD. Okay. Now, one of the most common ones, election periods that we use is usually Medicaid or LIS, right? And you can use that once a quarter again. So the first quarter is gone. Right now we're in the second quarter, April through June. And then the third quarter would be July through September. And from there on would be the fourth quarter, but we cannot utilize it because that's AEP. Okay. And then there's one last slide with some additional special election periods here, guys. So basically, I recently had a change in extra help paying for my Medicare prescription drug plan, like if they just enrolled into it, right? Or if they had a change in the level of extra help, or maybe they lost it completely. You do have to insert the date here. When did the change occur? Okay. If you have both Medicare and Medicaid, or my state helps me pay for my Medicare premium, or I get extra help from my state, Medicare prescription drug coverage, but I haven't had a change, That is that once per quarter. Okay. I live in or recently moved out of a long-term care facility, for example, like a nursing home and things of that nature. That will also allow you, if you're moving out of it, or you're moving into it, that will create also a special election period. Okay. And then I reside at home, but require a level of caregiving in the nursing home. That will also be one. I recently left the PACE program. You just have to insert the date. And then I recently involuntarily lost my creditable coverage, drug coverage, coverage as good as Medicare's, right? You lost your drug coverage. And then you have to insert the date here. All right. If you have any questions, just reach out as it pertains to those or anything else. I'd be happy to help.